Okay, so we're going to be looking through the posture seated and standing. So here, seated, I'm just looking for the posture from the shoulder to the hip to the ear, and make sure all of that's in a line together. And also from the side, I'm just going to look to see if there's any obvious observable kind of anterior or posterior pelvic tilt going on. So what I would do now is I would come behind her and just kind of look from above to see is there any rotation going on of her hips, which all of that is fine. So put my hands on your hips for a second, and I'm just going to move your hips in again and tilt. So we're going to come backward, and then come forward like that. Okay. So I want you to do that motion. I'm going to put my hands underneath your ischial tuberosity and underneath your hips here. Okay. So under the ischial tuberosities. Alright. So can you do those motions again, rocking forward and backward? And I'm just seeing how her weight's shifting during these motions here. Okay. So can you lean side to side for me? Good. And then can you lean forward and then lean backward? Good. Okay. So all of that's fine. I'm also, while I'm back here, just looking to see if there's any observable like hip hike while she's seated. Everything looks fine from here. So what we'll do now is we'll come to stand. And I'm actually standing, I'm looking for the pelvic tilts. So as she's saying, she should have some kind of anterior pelvic tilt going on. But while she's standing, I'm just looking to make sure everything's in a line. So from ear to shoulder to hip to feet. And while I'm here at her feet, I'm looking to see if there's any kind of overpronation or supination going on from that. And from here, her pelvis looks pretty stable. I'm just going to feel right here. Yep. So the ischial crest, iliac crests are very even here. So we're going to walk a little bit. So as we're walking forward, I'm just going to look to see if there's any excessive anterior or posterior pelvic tilt. I'm looking to see if there's any hip height when she's walking or any kind of excessive rotation that's going on. Okay. Another thing I'm looking for is just to see if there's any kind of excessive trunk flexion or extension that would impair the walking.